This because each home remedies or Ayurveda remedies differs with the constitution of the person. So it will not be just as you said, one medicines for all the people. May not be. For you it may work better, for others it may not work better. So usually doctors, what they do is they choose the body constitution, and based on the constitution of the body and the what medicines, how the medicines are affecting, they try the permutation combination of medicines. You're able to follow me?
Yeah.
So just very grossly remember that Vata, Pitta, Kapha, and there are around 48 to 120 questions which usually they ask. Each one of them they'll be asking. Each Ayurveda doctor usually should take at least around 30 to 40 minutes to assess a person. The way patient walks into the consultation chamber, the way he sits down, the way he starts interacting, every point of view Ayurveda doctor will be observing how is his weight, how is his gait, how he is looking at the consultant, So usually they will not be revealing this, but this is a very gross overview to just understand in a common way. So this is a little more explanation which I will not go much detail. Vata mainly says it's early winter or a late fall. So it's a duration. Each year is divided into more of dominant Vata, dominant Pitta, dominant Kapha. So our diet changes with each season. Can you see this? Each season based on our constitution and our diet can also change. So we have to, it's not like a very fixed diet that I have to follow only this. May not be. Some diet may work for you, some diet may not exactly work for you. So I'll just Next. So what I do is, I want you to fill this particular form later, may not be now. We will not go in much detail about this. I will give you one form where you will be ticking what kind of your hairstyle. If somebody is very curly hair, this is something. If somebody is very sticky hair, is different. Somebody is having soft hair, that is different. Somebody's body sweat is too smelly, there is more of kapha. Like that there are different questions based on our visibility. If somebody's forehead is very short, more of vata. Like this there are some 47 questionnaires which I'll give you through email, I think. So that's better. Are you okay with this?
Sir, this situation will be across the personality or age groups?
Across the personality.
Now after 40 I may change into kapha from vata?
No,
it will be standard.
It will be stable. So as I said, at the time of our birth, our what will be dominant will be determined. Some of us will be more of vata kapha. Some of us will be more of kapha pitta. Some of them will be more of pitta vata. Based on different features. The features will not go much detail. This is not exactly time. It needs at least some 40 minutes to assess. Okay. So Ayurveda almost more than 5,000 years of history, and it describes, during that time it describes diabetes as a madhumeha or prameha. Madhu means honey. Meha is body. Body is like a sweet like honey. So there is a little classification which I'll share with you, but I don't want you to go much detail into this context. So it describes into two main categories. So you can see those words. I will go with this. Sahaja prameha, apatya nimitta prameha. Sahaja means very casual or congenital, because by default it comes to you. For example, type 1. Are you able to correlate? So it was very difficult for me to catch these words from the Sanskrit context of an Ayurvedic books. It's a bit difficult for me, but I could grab these few contexts. So Sahaja Prameha, where they consider it as it comes by default. Congenital or type 1 diabetes, where there is a lack of secretion of insulin from your beta cells by default. Second one, apatya nimitta. Nimitta means they'll say because of. Nimitta is because of. Apatya, you are not able to follow the lifestyle properly. So the diabetes. So this can be mainly said as type 2 diabetes or insulin resistance diabetes, where the insulin secretion is normal but your body is not able to take up or use that particular insulin. So most of Indian context, most of us are the second variety, apatya nimitta prameya. Let me grasp these words. Okay. Again, Sanskrit words. Apatarpana utthaja prameha. Santarpana utthaja prameha. Will not go much details again. Apatarpana, the person who is very lean and having diabetes, whose body metabolic activity is more and he is still having diabetes. The person who is very lean and diabetic. Santarpana utthaja means born out of more nourishment, born out of less nourishment, something like this. This word's meaning is this. Apatarpana, santarpana. Well nourished person who is having diabetes means obese person who is having diabetes and lean person who is having diabetes. Is it okay with you? At the back of your mind you categorize yourself where we fall in. Are you able to go through this? So most of us will go for apatya nimitta prameha, and if we are obese we go for the second one, santarpana utthaja prameha. If we are very lean we go for the first one. And again, based on the vata pitta kapha, there are subcategories. There are 5 types of vata, there are 5 types of pitta, there are 5 types of kapha. So there is a thin line between yoga and Ayurveda. Yoga describes 5 energies. That's why they say yoga and Ayurveda are a sister science. I will tell those 5 energies. First energy is Udana. Udana is all the upward movement of energies, like sneezing, coughing, spitting, vomiting, talking, crying, yawning. All the energies goes up. Are you able to accept this? Udana, prana. We'll say pranas are divided into 5. Udana. Udana is upward energy. With Udana, again it can be categorized into Udana Vata, Udana Pitta, Udana Kapha. Will not go much detail. It is a bit confusing. Is it confusing? Is it confusing? So there are 5 energies with yoga context. We will only know about that. One is Udana is upward energy. Apana is a downward energy, where passing a motion, defecation, urination, sexual activity in women, delivering the baby or monthly periods. All energies goes down. Do you agree with this? This is apana vayu, apana energy, this prana. So to balance this upward and lower energy, there is something in between called as samana. Is a digestion. The digestion is a samana. So 3 energies: Udana, Apana and Samana. 4th one is Mahaprana. Mahaprana means breathing. See, there is in what sentence I am using, there is a hidden treatment which you can capture is Mahaprana is breathing. So most of the time, if you work on the breathing techniques, you can indirectly work on the diabetes because you can work on Mahaprana. 4th one is a Mahaprana. 5th one is Vyana. Vyana means body sensation. All the body sensation throughout your body. Touch, sensation of a touch or a pressure or a pain or a cold or hot or different sensations of the body can be called as Vyana. So 5 energies: Udana, Apana, Samana, Mahaprana and Vyana plus 3 Vata, Pitta, Kapha. It can be again categorized into 7. But again into this permutation combination, they say there can be some 48 varieties of diabetes. So in the modern medicine, we usually know that there are 2 or 3 or some of permutation combinations, 3 or 4, at the max 5, just diabetes. type 1 diabetes, type 2 diabetes, or there are a few others which I don't remember. So out of this 5 or 7, are you able to follow this? So there can be permutation of combination based on this 2 set of types and this 7 set of types. Into this permutation combination there can be around 48 varieties of diabetes. Yeah. So 48, it is based on the constitution. Modern science usually focuses on what exactly is a problem, and it's like what is this one particular point there is a problem.
They solve the problem.
Yeah. So we go into a reductionist approach in the modern medicine, but in Ayurveda they go into a holistic approach. I'll consider the mind, body and soul as a one particular whole entity, but in our modern medicine we focus mainly on the physical body. So there is a little difference. And modern medicine again, it is considering the importance of alternative medicine. So that's why there is an integrated medicine. So I want you to note down this particular word, integrated medicine. So this is the best gift of modern medicine, is integration. It means evidence-based integration of different modalities of treatment based on our problems. Yeah. So that is one of the biggest institutions which exclusively focused on yoga and Ayurveda. But again, in integrated medicine, it can be anything. It can be acupuncture, it can be Ayurveda, it can be homeopathy, it can be naturopathy, it can be biorhythm training, it can be some of the psychotherapy techniques. So it is anything and everything under the sky which can be used for this particular patient, for this particular disease. I can use it as an evidence-based form. You're okay with this? I'll not go much detail into this. Otherwise I'll make you sleep. Any questions till now? You can ask.
That's the problem with diabetes. They go to sleep fast. Unusual times.
That's why we say 15 to 20 minutes is your attention span. So after 15 minutes, I'll see some of people, if they are going for drowsiness like this, I'll stop and I'll ask them some questions. You can interact something if you want to ask something. See, this context will go more into what I get completely out of it, rather than trying to learn all the Ayurveda in 2 hours.
But yeah, concentration about the body functions.
Yeah. So again, modern medicine goes back to saying that this is all more of diseases to this modern lifestyle related diseases are mainly due to mind and body, mind-body related diseases. So if there is a mind-body related diseases, I have to understand there are 2 important control mechanisms of our body. I want you to raise your hand, all of you. Only move your right index finger. Okay. Move your right little finger. Only one. No other finger should move. Okay. Drop your hands down. From the left hand, touch all the 5 fingers and release. Only move the left ring finger. Okay. You can see your finger, only one finger is moving. Is it? Yes or no? So now, drop your hands down. Move 5th little toe of your feet. Only one. You should not move any other fingers. You should not move. Why? Why?
Because these 4 are connected.
You try. You can try. This is to reduce the drowsiness. Try. Let us move left toe. What do you call 3rd toe? You can move. Only that. You cannot. So it means I cannot. That's why I'm wearing socks.